Hello everyone, today I'm going to talk about epagliflozin cardiovascular outcomes and mortality in type 2 diabetes. I'm a student of the Catholic University in Santiago, Guayaquil of the Faculty of Medicine. Here's my picture and some data, my name, Twitter and mail if you have any question. First of all, what is type 2 diabetes mellitus? It's a metabolic disorder that is characterized by hyperglycemia, that is high blood in sugar, in the context of insulin resistance and relative lack of insulin. This is in contrast to diabetes mellitus type 1, in which there is an absolute lack of insulin. Here's a small video about the basics of diabetes.
Type 2 diabetes is a condition in which your blood sugar level is too high. After you eat foods that contain carbohydrates, chemicals in your small intestine break them down into single sugar molecules called glucose. Next, the cells lining your small intestine absorb the glucose, which passes into the bloodstream. When the blood reaches your pancreas, beta cells inside the pancreas detect the rising glucose levels. To reduce the glucose level, your beta cells release insulin into your bloodstream. As the blood circulates through your body, the insulin and glucose exit the bloodstream into your tissues to reach your body's cells. Most cells of the body have certain receptors on their surface that bind to the circulating insulin. Insulin acts like a key in a lock to open up the cell so that the circulating glucose can get inside the cell. Now your cell can use the glucose to produce the energy it needs to function properly. If you have type 2 diabetes, either your pancreas does not produce enough insulin, or your body's cells resist its effects, or both. If you have insulin resistance, your insulin cannot unlock the cells to let glucose in, because the locks, called receptors, are abnormal or missing. As a result, glucose is locked out of your cells. Consequently, the amount of glucose builds up in your bloodstream in a condition called hyperglycemia. To compensate for hyperglycemia, your pancreas produces more and more insulin. Your overworked beta cells try to keep up with the demand, but gradually lose their ability to produce enough insulin. Due to hyperglycemia and the lack of insulin, you may experience the following classic symptoms of diabetes: excessive hunger, excessive thirst, increased urine volume, and unexplained weight loss. Symptoms of type 2 diabetes that may appear over time include fatigue, recurrent infections, changes in vision, itching, and tingling or prickling sensations in your skin. Life-threatening complications of type 2 diabetes include diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic syndrome, and hypoglycemia. If you don't receive treatment for hyperglycemia, diabetic ketoacidosis can result. Because you no longer have enough insulin circulating in your blood, your cells can't get the glucose they need to produce energy. As a result, your body turns to fats and proteins as an alternative source of energy. During the fat breakdown process, certain byproducts, known as ketone bodies, accumulate in your blood, resulting in a condition called ketosis. If ketones build up to dangerously high levels in your bloodstream, you may develop diabetic ketoacidosis, or DKA, which can lead to coma and death. Another complication resulting from failure to treat hyperglycemia is called hyperosmolar hyperglycemic non-ketotic syndrome, or HHNS. As the insulin deficiency continues, your blood glucose level increases. In response, your kidneys filter excess glucose out of the blood into urine, along with large amounts of water. Unless you consume large amounts of water, your kidneys cannot keep up with the demand of removing the glucose from your bloodstream and diluting it sufficiently in urine. As a result, your blood becomes much more concentrated than normal, a condition called hyperosmolarity. Hyperosmolarity pulls water out of your body tissues into your bloodstream, causing severe dehydration, which may lead to hyperosmolar hyperglycemic non-ketotic syndrome.
Well, let's talk about the epagliflozin, the drug. Epagliflozin is a drug of glycine class approved for the treatment of type 2 diabetes in adults in 2014. It was developed by Brianna Ingles and Eli Lilly and Company. Epagliflozin is an inhibitor of the sodium glucose cotransport 2, known as SGLT2, and causes sugar in the blood to be excreted by kidneys and eliminated in urine. Side effects: when taken in doses of 10 to 25 milligrams once a day, the incidence of adverse events was similar to placebo. However, there was high frequency of genital infections. There are concerns it may increase the risk of diabetes ketoacidosis. Post-market studies. In August 2015, release of the post-marketing clinical trial EMPA reg outcome addresses the addition of epagliflozin to standards of care for preventing myocardial infarction, stroke, and cardiovascular death. In conclusion, patients with type 2 diabetes and high risk of cardiovascular events who receive epagliflozin as compared with placebo has a lower rate of primary composite cardiovascular outcome and of death of any cause when the study drug was added to standard care. Thank you.